In this video, I will suggest activities and environmental accommodations for the client, and I will explain the strategies we use for 3 groups of behaviors. Behavior 1. The client is covering his eyes to avoid the light, screaming if his face gets wet, screaming if there's a tag on his clothes. These behaviors often happen if the individuals are hyper-responsive. They engage in behaviors because of sensory overload. Their brain gets many signals about clothes on their bodies, so it's difficult for them to focus on anything else. This is uncomfortable for them, so they may start strange behaviors such as crying, undressing, or pulling out the clothes tags. For these sensory challenges, we can help the client with environmental accommodations by removing the clothes tag or turning to sensory-friendly clothing. We can also use a sensory diet. A sensory diet is a group of activities that are scheduled into a child's day to suit his needs. Some of the activities that could help hyper-responsive individuals are hiding objects in the bin for your child to find. Or you can use tactile bins. The tactile bin is a large container filled with a large variety of different materials such as shredded paper, beads, water, sand, and more. By regularly playing with different textures, it will help your child to become more comfortable with how textures feel in their hands. Start with dry textures, then move to semi-wet, and then wet. After a while, their tactile system will greatly improve. Firm pressure. Applying deep pressure or engaging in heavy work activities is recommended when a child shows sensitivity to touch or being touched. Heavy work or deep pressure is calming and makes your child less aware of the feeling of touch, in particular light touch. You can apply deep pressure with your hands when washing their hair, brushing their fingernails with a nail brush before nail clipping, squeezing their hand or their forearms, or finally hugging them if they like hugs. Behavior 2. The client is looking for certain textures to rub and feel. He is chewing or biting non-food items, putting things in his mouth to get more sensation or a taste simulation. He is flashing the lights on and off in order to get a more visual simulation. He does these strange behaviors because he is not registering enough sensory stimulation, and he resolves this problem by actively seeking it. For these sensory challenges, we help the client with environmental accommodations by giving him sensory toys to play with. Also, we can use a sensory diet to satiate the sensory needs he is seeking. There are some activities that could help hypo-responsive individuals, such as messy play including finger painting and sandboxes, smelling games, hiding scented objects in bags and explore by touching, arts and crafts with a variety of textures, ball pits, gardening and digging for worms, baking and making dough, playing barefoot in the grass or in the sandbox, playground equipment that offers various types of movement including trampolines, swings, and climbing walls. Behavior 3. The client is finding it difficult to do up buttons. The client is finding it difficult to tie his shoelaces. The client is finding it difficult to kick or catch the ball. Dyspraxia affects individuals' motor skills, balance, and coordination. It may also affect their organization skills and their ability to follow or remember instructions. Coordination is what happens when you use 2 or more body parts at the same time to complete a task. For helping individuals with dyspraxia, there are some activities for fine motor skills, gross motor skills, and coordination. Coloring. We can use markers, crayons, or pencil crayons, starting with an easy page until we reach a more adult coloring book. Play-Doh. Play-Doh helps strengthen the fingers and develops fine motor skills and helps in eye-finger coordination. Eye-finger coordination means the ability of the eyes to coordinate visual information and direct the hands to perform a task. Cutting and craft activities for helping the child to hold a pair of scissors properly and hold the paper with their other hand, controlling the paper as they cut. We can use a special kind of safety scissor that's made especially for teaching the child how to use scissors. Threading and lacing. Threading is an excellent activity for developing fine motor skills. First, you can start with threading on paper until they are able to do some sort of embroidery. Lacing is also an excellent activity for developing eye-hand coordination, starting with a larger size until they're able to reach a smaller size bead. Puzzles. Start with a larger wooden piece until you're able to reach a smaller size. Blocks. Blocks help develop fine motor skills and eye-finger coordination. Start with large wooden blocks until they're able to reach a smaller size. Small toys and rubber balls with spoons are simple and fun activities for kids to develop fine motor skills, eye-finger coordination, and balance. Trampolines, jungle gyms, and playground activities are also good for improving gross motor skills and balance. Toys to ride on such as bikes, scooters, and skateboards are good to improve gross motor skills and balances. Ball games that would require kicks and catches are also good to improve gross motor skills, balance, and coordination.